My name is Megan Connolly, and my topic is quality improvement in U.S. public health organizations. United States public health organizations play a vital role on the health of our local communities and the health of the nation as a whole. It is crucial that these organizations are run using a total quality approach. These organizations help to identify emerging diseases, they aid in preventing epidemics, they promote standards of health protection, and much more in order to protect the health of the public. As you can see, U.S. public health organizations must operate in the most efficient ways possible in order for their efforts to be the most successful. Different means of quality improvement can be implemented into these organizations to guarantee success. According to Thomas Frieden, MD, there are 6 components required in order for public health organizations to achieve effective results. These components go hand in hand with the methods Goesch and Davis offer in their textbook to achieve total quality. Frieden explains that you can picture the 6 components needed for quality improvement in the shape of a wheel. Innovation is the central hub of the wheel and is the driving force and support for the other 5 components. Innovations can pertain to science, medicine, information systems, communication techniques, and more. Steps from the Durand trilogy can be used in conjunction with innovation to work toward total quality. According to Joseph Durand, quality improvement involves identifying specific processes of methods in need of improvement. Innovations can be used to perform program evaluations to determine what is working as expected and what is not. Thomas Frieden, 2014. Joseph Durand determined that quality planning involves identifying the needs of customers and developing products based on customers' needs. Customers can actually be used as innovation partners. This is known as customization revolution. Customization revolution involves partnering with customers to assist with product innovation. Davis and Goesch, page 102. The idea behind this is that customers know firsthand what is needed to satisfy their needs. Frieden notes that the most effective public health programs are based on an evidence-based technical package. Thomas Frieden, 2014. This is the next component that can be utilized to help achieve quality improvement. The technical package is a set of connected interventions that work together to provide improvements in the outcome of a disease or a certain risk factor. The package should be simple and affordable. It helps assure that focus stays on the most productive and supportable interventions. Implementation of any quality improvement efforts, including the aforementioned, is dependent upon management of performance. In the public health sector, performance can be hard to measure, as many times the influence and results of these programs may not be apparent for many years after they are implemented. Continual improvement of processes, people, products, the working environment, and every other factor that affects performance is at the very core of the operating philosophy. Davis and Goesch, page 79. In regards to organizations that have a quality culture, Frieden recommends using simple systems in an effort to have timely performance feedback. He gives an example of a system used to track tuberculosis. The tuberculosis patient registry was maintained by public health organizations, which helped track the outcome of each patient being treated. Frieden notes that it is frequently hard to hire, train, and keep the qualified staff necessary in order to carry out efficient public health programs. However, effective resource management can be acquired through career building. Management can play the mandatory leadership role in continual quality improvement by substantiating an organization-wide quality council, working with the council to establish quality improvement goals, providing required moral and physical support, calendaring recurrent reviews, and intertwining continual quality improvement measures into the usual reward system. Davis and Goesch, page 327. Partnerships are crucial to the success of public health organizations. Public and private health sectors need to work together to share information and ideas in order to continue to improve the population's health. Thomas Frieden, 2014. Frieden notes that effective partnerships can be difficult to establish and keep up with, and that sharing resources amongst local and state health departments can be politically backed and difficult. Partnering with potential competitors sounds like an odd strategy on the surface. Davis and Goesch, page 72. Organizations can build a manufacturing network that work together in order to increase quality and productivity beyond what the organizations could reach on their own. The Practical Playbook has a great video of Dr. Denise Koo explaining the importance of partnerships. Partnerships between public health and healthcare are a critical foundation for improving the health of the American public. She states that we can work together to improve population health and improve the quality of care. The next component needed to work toward quality improvement of public health organizations is communication. Communication is vitally important for the success of any organization. If total quality is the engine, communication is the oil that keeps it running. Davis and Goesch, 2016. According to Thomas Frieden, communication of correct and timely information must be relayed to all players involved: the healthcare community, decision makers, and the public. Effective communication needs to happen internally and externally. Internally, leaders of the public health organization must communicate with their employees in order for their staff to commit to striving for quality improvement. Davis and Goesch. Externally, effective communication must happen between the customers, or in this case, the citizens of the United States, to determine their needs. This can be done by listening, asking, observing, and probing. Davis and Goesch, page 159. Effective communication is so important in public health organizations as it is used to convey critical information to individuals who can help bring about public health action. A quality program is one that effectively uses communication to disseminate information about health to the public. The last component public health organizations can use to improve quality is through political commitment. Political commitment can bring to fruition the resources required to create changes and sustain public health interventions. Thomas Frieden, 2014. Moreover, political commitment can help overcome opposition to public health programs. Preventative measures promoted by public health organizations can be successfully implemented with political commitment. Thomas Frieden is a medical director. He is an American infectious disease and public health expert, and he was the former director of the CDC. He was also selected by President Barack Obama to be the administrator of the Agency for Toxic Substances and Disease Registry. Therefore, I believe he is very well educated and well versed on what steps need to be taken to improve quality in public health organizations. I think by implementing the 6 components he has suggested and as aforementioned: innovation, technical package, effective performance, management, partnerships, communication, and political commitment, quality improvement of public health organizations can be greatly improved. The suggestions of Davis and Goesch can be intertwined with Thomas Frieden's in order to successfully achieve implementations of these quality improvement measures.